Now, a group of drugs are oftentimes referred to as mood stabilizers, and that is really kind of a misnomer. That's why in the stuff that I write about, I call them bipolar drugs, because the truth is that most of these drugs are not mood stabilizers. Now, let me give you a perfect example, and that is Depakote, often referred to as a mood stabilizer. Guess what? Depakote really does not treat bipolar depression. Okay? It's a great anti-manic drug. There's some of these drugs that don't treat mania at all, but they're very good for bipolar depression, like Lamictal. Okay, so if you want to really get technical about it, a mood stabilizer, by definition, treats both mania and depression, but prevents manias and depression. And if you look at, okay, then so what drugs are mood stabilizers? There's two of them. Okay, only two: lithium and Seroquel. And again, there are other drugs that are used that are good, but they treat only certain aspects of the disorder, like manic episode, like Depakote, for instance. Okay? Is that clear? Both of these drugs treat depression and mania, and both of them can prevent reoccurrence. Maybe I'm being, persnickety about this definition, but I think a lot of the researchers are saying, let's get a little bit more accurate about what we call these drugs. FDA-approved medicines for bipolar disorder. Here they are. The main thing I want to highlight is that most of these are antipsychotic medications. Okay. Now, lithium is in a class by itself. Okay, and then thorazine, Zyprexa, Risperdal, Seroquel, and so forth are all antipsychotic drugs. And then we have a couple of anticonvulsant medications that were originally developed to treat epilepsy. Depakote is one of these. And then Tegretol has been used for probably 30 years to treat bipolar disorder, to treat mania. But it never got FDA approval for treating mania. But a newer version, which is a sustained release version of the same drug called Equitro, got approval in 2005. What I don't have in here is a slide that maybe I'll bring it into the next class, or make a copy for you, of bipolar drugs that are approved for children. Okay, and it's just at the end of this last year that they got FDA approval for some of these drugs for use with children. Okay, Symbyax and Seroquel are the two drugs that are FDA approved for treating bipolar depression. Okay, and let me point something out here, and that is Symbyax is a combination of Prozac and Zyprexa. Now, there's two things here. Number one, whoa, wait a minute. There's an antidepressant in there. How did they do that? How did they get that in there? Didn't I just say antidepressants cause problems? Yeah, I don't know the answer to that, but they got it through FDA. Getting FDA approval is getting to first base, and then you got to wait and see how things really turn out. Okay. The other big problem with Symbyax is it's got Zyprexa in it, which is a very good anti-manic agent, a very good antipsychotic, and has a lot of side effects. Okay. I don't think this is being used very much. Okay, but it made the FDA approval list, and Seroquel is for acute bipolar depression. And then in terms of maintenance, which means prevention of relapse, prevention of recurrent episodes, then there are just a handful of drugs. Lithium, Lamictal is only FDA approved for preventing depression. And actually, there are some case studies that show if you use Lamictal alone, it may actually cause mania. Not often, but it can on occasion. Okay. But that's just the FDA story, okay? There's a lot of off-label use. And I think we talked about this in an earlier class. This is where it's not FDA approved for this particular disorder, but because they find out it works, you can use it, okay? And the best example of this is, second to lithium, the drug that's probably been used the most to treat bipolar in the last 40 years is Haldol. Haldol is an excellent anti-manic agent, but it's never gotten FDA approval for treating bipolar disorder, okay? So there's a lot of off-label use. Whoops. Let's go back here. Okay. So let's leave the FDA stuff aside and just look at what people are using to treat bipolar. And here are the drugs that treat acute mania, and prophylaxis is to prevent reoccurrence. So all of these drugs have support for preventing reoccurrences. And the ones with the asterisks, these are anticonvulsant medications, okay? Any antipsychotic is a good anti-manic agent. Now, if you look at mania, 70% of people who have mania have psychotic symptoms. But please keep in mind, even if you don't have psychotic symptoms, antipsychotics are good anti-manic drugs, okay? And then lithium. Dysphoric mania, which, as we talked about before, is tougher to treat. And that's really too bad because this is one psychiatric disorder and episode that has some of the highest suicide rates of all, is dysphoric mania. Depakote appears to be the leader. Okay, a slight edge over these other drugs, oftentimes because you have to combine medications. It's not unusual that you'll see a combination, Depakote and lithium or an antipsychotic. And there are many things that have been tried for treating rapid cycling. First thing you do is, and you might, get this like on an exam someday, somebody might ask this question. What's the first thing you do with rapid cycling is you try to find out what's causing it and then get rid of it. It's like they're using cocaine or antidepressants. Before you start giving them medicine, get rid of what's causing it probably, okay? But the one drug that has research support for treating rapid cycling is Lamictal. And it's good for that. I've seen some good results with people who've had really hard to treat rapid cycling. Okay. Now, black box warnings, highlighted in the package inserts and in the PDR. It's not important to know all of these. The point that I'm making is when you step into this arena of bipolar medicines, we're now talking about drugs that not only have a lot of unpleasant side effects, but they also have a handful of potentially deadly side effects, okay? And let me just tell you one really great concern that I have, and I've heard this again and again and again, and I heard it yesterday, again, from a school nurse who came to this talk, is, God almighty, all these kids are coming in and they're on Depakote, and a lot of these kids are being treated by primary care pediatricians, and turns out a lot of them are coming from lower socioeconomic groups, and the question is, do all these kids have bipolar disorder? And my answer to that is, well, I don't know, but probably not. We're going to see that there's a lot of behavioral problems that they're bipolar, and they stick them on Depakote. If Depakote were a benign medicine, that would be a different story. But look at here. It can, liver failure and pancreatitis can kill you. And we're going to see that with girls and young women, that if you don't watch them very carefully, chronic treatment of Depakote can cause permanent infertility. So it's really not something that treatment that is entered into unless you have pretty convincing evidence that this person in fact really needs this drug and has bipolar disorder. Now, medicines for bipolar mania, Trileptal was on the list before in treating acute mania. It appears to be effective. It's just that there's not a lot of research to support it, but it certainly is used. Trileptal is a kind of a slight variant of Tegretol that has a better side effect profile. Okay, Topamax, there are case studies of it working, but most people now agree that Topamax does not treat mania. And so we'll talk about what Topamax is good for here in just a few minutes. Okay. medicines that are not effective in treating bipolar disorder, treating mania. I mean, Neurontin. Neurontin is also known as gabapentin. Now, Neurontin, for a while, people were excited about the use of Neurontin to treat mania because, compared to the other drugs, it had really very few side effects. The one biggest problem, though, was it doesn't work. Oh, yeah, but other than that, it's great. There have been three studies where they have looked at placebo versus Neurontin for treating mania. In 2 studies, it was no better than placebo, and I'm not making this up. The 3rd study, placebo was better. But as placebos go, it's a pretty good drug. Now, we're going to see that Neurontin has a role to play because it treats anxiety, okay, but it's not good for treating mania. And then this drug, this is really bizarre. This is, Gabatril is an anticonvulsant, and yet there are people that, when they're treated with this, have seizures, and it's when they miss doses, they'll have seizures. So I think that this is not being used very much these days.